Hi, dear nurses. This is again Hya, and I am an educator here in the Middle East Online Review team of IPAS Online Review and Mentoring Academy, the online review mentoring of IPAS processing. And for today, we're going to have another common topic in your Middle East exam, and that is ECG tracing and dysrythmias. All right, so let's see the question here. We're going to answer the question and give our rationale and the test taking technique and strategy. So let's read. The nurse is monitoring a cardiac patient when suddenly the tracing on the cardiac monitor displays ventricular tachycardia, but the patient shows no signs and symptoms of decreased cardiac output. What should be the appropriate nursing intervention of the nurse? Option 1, start CPR. Option 2, prepare for cardioversion. Option 3, administer oxygen. And option 4, prepare for defibrillation. Like what I've said before, dear nurses, look first for the clue for you to be able to answer this question. It says here the nurse is monitoring, and the monitor displays what? Ventricular tachycardia. So we are looking now what will be the management for ventricular tachycardia. However, the patient doesn't show any signs and symptoms of decreased cardiac output. So for this case, dear nurses, before you start CPR or to do any other intervention, you should assess first. So when you assess, check first for the placement of your cardiac monitors or of your pads. Why? Problem in placement could lead to what? Incorrect ECG tracing. So if you're able, or if you're done with the assessment, with the checking of the placement of your pads, you can now check for the pulse of the patient. All right. The patient doesn't have signs and symptoms of decreased cardiac output. The pulse of the patient is good. The heart rate of the patient is good. So if that's the case, let's see now the tracing. So let's see first here. The ECG tracing is ventricular tachycardia, meaning that the QRS complex, it's widened. The P wave is not seen, so we cannot see the atrial contraction. The QRS only, or the ventricular contraction, is the one only seen, and it is prolonged. With this case, you should not start CPR. So option 1 is incorrect. Why? You should not start CPR because the patient is not showing any signs and symptoms of decreased cardiac output, meaning the patient still has pulse. The patient still has the normal delivery of oxygen to the systemic circulation. So do not start CPR yet. We only do CPR if the ventricular tachycardia is pulseless or without pulse, or the pulse is weak or getting weak. All right. Option number 2, prepare for cardioversion. What is cardioversion, dear nurses? All right. Cardioversion is, okay, the patient is placed with pads. All right. So we have the 2 techniques for your cardioversion. You can place the pads here. Let me just draw here. Okay, so this is the first technique on placing the pads. So pads here on your right side of the chest and just below the mitral valve or below your apex. All right, so that is the first placement of your pads. And another technique is just on the center. So you just put your pads here on the center of the chest and one at the back. So that is the second technique to place your pads. So that is cardioversion. So when the pads are placed and the patient is hooked with an IV line, the doctor will going to monitor the ECG tracing. All right, and then the doctor will going to deliver the shock through that machine. When the shock is delivered from a chaotic rhythm to a normal sinus rhythm, all right, after your cardioversion. So this is basically your cardioversion. All right, let's go back here. Okay, so if the patient, if you're going to prepare for cardioversion, this is not the best possible answer for this question, because again, the patient has no signs and symptoms. The patient still has pulse. All right, number 3, administer oxygen when the patient is having ventricular tachycardia. The ventricles are contracting rapidly and chaotically, so you really need to administer oxygen. Why? The heart needs oxygen and the systemic circulation needs oxygen as well. All right, so option 3 is a possible answer. And option number 4, prepare for defibrillation. Option 1 and option 4 are given to patients or are done to patients who has ventricular tachycardia without pulse and for patients who has ventricular fibrillation. That is why we call it defibrillation. This is for patient with fibrillation. All right. So if option 1 and option 4 are for pulseless ventricular tachycardia and option number 2 is also for ventricular tachycardia, but not for the one with pulse, therefore, the only remaining option is option number 3. And that is to what? Administer oxygen. Again, what's the reason why you need to administer oxygen, dear nurses? Because the heart needs oxygen and the heart is not resting anymore. It's having tachycardia. It is rapid. It is chaotic, right? And the body or the systemic circulation also needs oxygen. If you want to know more about this, if you want to know more about your dysrythmias, how to manage dysrythmias, and to the other most common topics in your Middle East exam, join us for the start of the class in the Middle East online review of IPAS processing. See you then in class. You have a good day. Bye-bye.